Medical terminology is the precise, universal language of healthcare, systematically built from three core elements: prefixes, word roots, and suffixes. A prefix is a word part attached to the beginning of a term to modify the meaning of the root word. It provides essential context about location, number, time, or status. We will begin with prefixes that describe location and position. Endo means within or inside, as an endoscope, an instrument to look inside the body. Ecto or exo mean outside or outer. Ectoderm is the outermost embryonic cell layer, and an exocrine gland secretes externally. Intra also means within, such as an intramuscular injection into muscle tissue. Inter means between or among, like the intercostal muscles between the ribs. Retro indicates behind or backward, key in retroperitoneal, the space behind the abdominal lining. Sub means under or below, as in sublingual, under the tongue. Continuing with location, supra means above or over. A suprapubic catheter is placed above the pubic bone. Infra means below or beneath, like the infraorbital foramen below the eye socket. Peri means around, a vital example being the pericardium, the sac surrounding the heart. Circum also means around, as in circumduction, circular limb movement. Para can mean beside, near, or abnormal. Parathyroid glands are beside the thyroid, while paralysis is abnormal loss of function. Epi means upon or over, like the epidermis upon the skin. Next are prefixes denoting number and quantity. Uni or mono mean one. A unilateral fracture affects one side. Mononucleosis involves one white blood cell type. Bi or di mean two or double. Bilateral pneumonia affects both lungs. Diplopia is double vision. Tri means three, as in the triceps brachii muscle with three heads. Quadri or tetra mean four. Quadriplegia is paralysis of all four limbs. Hemi means half, like a cerebral hemisphere. Semi means half or partial, seen in a semilunar valve. Now, prefixes describing amount, size, and degree. Macro means large. A macrocyte is a large red blood cell. Micro means small, as in microorganism. Mega, or the suffix, megaly indicate large size or enlargement. Megacolon is an enlarged colon. Hepatomegaly is liver enlargement. Poly means many, much, or excessive. Polyuria is excessive urine production. Oligo means few, scant, or deficient. Oliguria is low urine output. Pan means all or entire, as in pancreatitis, inflammation of the entire pancreas. Critical prefixes for measurement include hyper, meaning excessive, above normal, or high. Hypertension is high blood pressure. Hyperglycemia is high blood sugar. Hypo means deficient, below normal, or low. Hypotension is low blood pressure. Hypothyroidism is underactive thyroid. Normo means normal, as in normotensive. EU means good, normal, or well. Yapnea is normal breathing. Dice means bad, painful, difficult, or abnormal. Dyspnea is difficult breathing. Mal means bad or poor, like malabsorption, poor, nutrient absorption. Prefixes also relate to time, speed, and function. Pre means before, as in preoperative care. Post means after, like the postpartum period. Brady means slow. Bradycardia is a slow heart rate. Tachy means fast or rapid. Tachycardia is a fast heart rate. Re means again or back, as in rehabilitation. Anti means against, like an antibiotic. Color is described with specific prefixes. Leuco or albo mean white. A leukocyte is a white blood cell. Erythro means red. An erythrocyte is a red blood cell. Cyano means blue. Cyanosis is bluish skin from poor oxygenation. Melano means black or dark, as in melanoma. Xantho means yellow, like a xanthoma skin lesion. Chloro means green, like chlorophyll. Finally, prefixes describing state and condition. A or an mean without or absence of. Apnea is cessation of breathing. Anoxia is lack of oxygen. Auto means self. An autoimmune disease attacks the body's own tissues. Contra means against or opposite. A contraindication makes a treatment inadvisable. Neo means new. A neoplasm is a new growth, a tumor. Pseudo means false, like a pseudocyst. To apply this, use a systematic decoding strategy. First, divide the term and identify the prefix. Second, find the word root for the core meaning. Third, identify the suffix. Fourth, define each part and synthesize the meaning. For example, pericarditis breaks down to peri, meaning around, cardi meaning heart, and itis meaning inflammation, resulting in inflammation around the heart. Another example is hyperlipoproteinemia. Hyper, meaning excessive, lipo meaning fat, protein meaning protein, and emia meaning a blood condition, giving us excessive fat-protein complexes in the blood. Consider subcutaneous, sub meaning under, cutane meaning skin, and aus meaning pertaining to, which means pertaining to under the skin. For intravenous, intra meaning within, ven meaning vein, and aus meaning pertaining to, resulting in pertaining to within a vein. Analyze bradycardia. Brady meaning slow, cardi meaning heart, and ear meaning condition, defining a condition of a slow heart. Tachycardia is tachy, meaning fast, cardi meaning heart, and ear meaning condition, a condition of a fast heart. Hemiplegia decodes as hemi meaning half, and plegia meaning paralysis, so paralysis of one side of the body. Quadriplegia is quadri, meaning four, and plegia meaning paralysis of all four limbs. Look at hypoglycemia. Hypo, meaning low, glyc, meaning sugar, and emia, meaning blood condition, defining low sugar in the blood. Its opposite, hyperglycemia, is hyper, meaning high, glyc, meaning sugar, and emia, meaning blood condition, meaning high sugar in the blood. Examine the term intramuscular. Intra, meaning within, muscule meaning muscle, and are meaning pertaining to, defining pertaining to within a muscle. For perioperative, peri, meaning around, operate meaning to work, and I've meaning pertaining to the time around, surgery. Another key term is echocardiogram. Echo, meaning reflected sound, cardio, meaning heart, and gram meaning record, resulting in a record of the heart using reflected sound. Understanding these prefixes allows you to instantly grasp that a polyneuropathy is a condition of many nerves, that an antitussive is a drug against coughing, and that a neonate is a newborn infant. Let us examine more clinical examples. Tachycardia and bradycardia are directly related to heart rate measurement. Hypertension and hypotension define blood pressure status. Leukocytosis indicates an elevated white blood cell count, while leukopenia indicates a low white blood cell count. Erythrocytosis means an increase in red blood cells, and erythropoiesis is the process of making red blood cells. Melanocytes are the cells that produce dark pigment. A subcutaneous injection is given under the skin, while an intradermal injection is placed within the skin layers themselves. An epidural anesthetic is administered upon or over the dura mater of the spinal cord. Preoperative medications are given before surgery, and postoperative care manages the patient after the procedure. Antibacterial agents work against bacteria, while antiviral agents work against viruses. Antifungal medications treat fungal infections. These prefixes form the consistent, logical foundation upon which thousands of medical terms are built. By dedicating time to learn them thoroughly, you gain the key to unlock the entire language of medicine, making every textbook, patient chart, and research paper more accessible. This knowledge is not just for memorization. It is a practical tool for critical thinking and precise communication in clinical practice. When you encounter an unfamiliar term, you can now break it down systematically. For instance, cardiomyopathy is a disease of the heart muscle. Cardio meaning heart, myo meaning muscle, and pathy meaning disease. Nephropathy is kidney disease. Neuropathy is nerve disease. The prefix provides the first clue in this puzzle-solving process that is essential for medical learning and practice. The consistency of this language system across all medical specialties, from surgery to psychiatry, makes this foundational knowledge one of the most valuable investments you can make in your medical education. Thank you for watching. Don't forget to like, share, and subscribe.